Hello everyone, I'm Dr. Dolly Chavda working as a fetal medicine consultant in Vardhan Fertility, Banaswadi, Bengaluru. Today I'll be talking about the pregnancy scanning in the first trimester. Ultrasound is a very beautiful tool. It's a diagnostic tool which will connect fetus to the mother during the beautiful journey of pregnancy. So, today in the first trimester scan, I will be talking about two topics, that is early pregnancy scan and second will be the NT scan. So, let's talk about early pregnancy scan. It is also called as an EP scan or a viability scanning. In this scan, once the pregnancy is confirmed, we will do the scan to see the status of the baby. First of all, we will see the location of the pregnancy, where the pregnancy is located. It is intrauterine, that is at the normal location, or whether it is located outside the uterus, which is called as an extrauterine, and it is ectopic pregnancy. So that this pregnancy management will differ from there, which requires immediate interventions and particular emergency techniques to be done in the ectopic pregnancy. So once pregnancy is confirmed, we will see the pregnancy sac, yolk sac and the fetus along with the fetal heart rate. So before 7 weeks, we should see all these three things. Once that is confirmed, we also see the uterine anatomy, any adnexal masses, any pathology in the uterus, or if there is any hemorrhage blood collection inside the uterus. Also, we will see the number of fetuses and the sac during this time duration. If there is a twins or multifetal gestation, we can find out at this stage. Next scanning will be NT scan, which is also called as a nuchal translucency scan, or it is also called as a first trimester screening, which is more or less a new terminology given to it, that is first trimester anomaly scan. It is done generally between 11 to 13 weeks 6 days. In this time frame, the baby size has to be between 45 millimeters to 84 millimeters. So we will see 5 components during this scan. It is a most important scan after the EP scan. In this scan, we will see first of all the length of the baby, which is also the CRL, crown rump length, where we will do the dating of the pregnancy. So based on the baby's size, the fetus size, we will decide the dating. It will give you the new delivery date, that will be an expected delivery date, which will remain constant throughout the pregnancy. Second thing will be the structural survey. In this, we will see the structures. The organogenesis will finish by this time. So we will see the structures that has formed are proper or not, starting from head, skull bone, then the brain, then face to hands, chest, heart, stomach, and kidneys, spine, urinary bladder and legs. So we will do the structural survey during this time, and along with that we will see the nuchal translucency, which is the fluid behind the neck of the baby. It is called as an NT in short terminology. This fluid behind the neck will be present in all the babies. It will be within normal limit in the normal babies, and it will be increased in the babies with the chromosomal abnormality or genetic syndrome or any cardiac abnormality or a skeletal problem or any infections, and sometimes the cause are not even known. So this nuchal translucency is a very important landmark of measurement in this scan. Then along with that, we will do a screening for a maternal preeclampsia screening, and along with that fetal growth restriction screening. In that scan, we will see that the blood flows from mother to the baby, and based on that we will give you a risk assessment for the mother to develop high blood pressure later in the pregnancy, and the chances of baby being small later in the pregnancy, which is called as a fetal growth restriction. Along with that, we also see the cervical length. It is a screening tool if the cervix is short, or if there is a pathology, if the cervical length is small. Any interventions, if required, can be conducted after the scan. So these 5 components we will see. Along with that, this risk assessment for chromosomal abnormality will be done. So all human beings are made up of 46 chromosomes, that is 23 pairs. During the formation of the baby, if any structural problem, or if any numbers of the chromosome is increased, or if there is any problem in the structures of the chromosomes, hence this kind of abnormality will show some of the other markers on the scan, which is called as a chromosomal aneuploidy. In this scan, we will see the most common chromosomal problem, that is most common cause of the mental retardation, which is about Down syndrome. So in place of normally 2 chromosomes at chromosome number 21, we will have 3 chromosomes, which is also called as a Down syndrome, trisomy 21. So with this screening, we will give you some risk number. Every mother who gets pregnant will have some based risk, that is the priori risk, which is starts from the age of a particular mother. So based on that age risk, once we do the scan, we will give you a new risk, which will be an adjusted risk based on this baby's length and other markers and then NT. So this risk will be substantially reduced from the age risk if the things are within normal limit. And based on that, we will give you pregnancy as a high risk or either an intermediate risk or a low risk. So all these things will be conducted during the time frame of NT scan. Along with the NT scan, you'll be offered some screening blood test, because NT scan itself is only 75% accurate. So the blood test called as a double marker or a first trimester quadruple marker will be offered to you. By doing this test, we will combine with the NT scan, and the risk accuracy can be about 85 to 90% by both this tests. Thank you.